Today we have a broad range of issues that we're going to be covering, from the global level to the regional level to specifically in Pakistan. And just a short introduction about Globesight. We are impact consultancy focusing most of our efforts on the global south, trying to scale impact wherever we can, and particularly given the increasing problems and threats caused by climate change, we have been working and focusing on building a network of experts and leading thinkers to drive thought leadership across South Asia and the Middle East on the issues of climate change. And this is the second in a series of webinars that we've been hosting, looking at some of the issues and challenges that have come up. And our third one will be at the end of June in Dubai as we lead up to COP28, which will be yet another opportunity for the Global South to represent itself and to be represented in a forum which is trying, I think, as best it can to mobilize resources at a time of great need. So more specifically, in the case of Pakistan, I think we all know last year's unprecedented floods highlighted the urgency for action to tackle climate change. And in the aftermath of those floods, Pakistan advocated for the creation of the Loss and Damage Fund, which of course was put together at Sharm el-Sheikh and is one of the key focuses for COP28 this year, to operationalize that fund and to build a climate resilient Pakistan. And hopefully, if we can mobilize more donations to get 10 billion to rehabilitate affected populations across Pakistan, then we'll be in a much better place than we were just 8 months ago. The focus is, of course, on post-disaster reconstruction. It's necessary. However, we need to have a dialogue looking at the multi-sectoral impacts of climate change, particularly with regards to food security, health, and gender equality. And today we're going to explore the interconnectedness of those issues. And we have an expert panel who we are very fortunate, both for your time and for your passion for this topic, joining us today to discuss these problems. First up is Afia Salam, who trained as a geologist, but actually, as many as you know, is a very published and widely hailed journalist and civil worker, and she's extremely committed to the cause of civil society and development, particularly working on livelihood generation and water management initiatives. Many of you will have seen her in recent webinars where she has been passionate about discussing the impact of COP, some of the things that can be done to improve it in the Pakistan context. Next up, we have Dr. Ismahane Elouafi, who is the Chief Scientist at the Food and Agriculture Organization, the FAO of the United Nations. Dr. Elouafi has held many scientific leadership positions, and she's worked as a scientist with several international research organizations. And most importantly, she's a strong advocate for into neglected and underutilized crops, and importantly, rethinking food systems. We have Dr. Farhana Shahid, Globesight's very own Dr. Farhana Shahid, who is a social and developmental sector expert with more than 25 years of professional experience in both public and private sectors in Pakistan. She's a medical doctor by profession and holds expertise in nutrition, reproductive health, and gender, and she's a senior associate at Globesight. Last but not least, we have Ramina Khurshid Alam, who is serving as the Minister of State and convener for the Parliamentary Task Force on the SDGs in Pakistan, actively advocating for women's empowerment across governance, business, and technology, especially in the wake of social change. And with that, we will have just a few seconds to discuss some of our latest research on navigating the nexus of climate change, health, and nutrition. So, as we've identified, and as this group has already convened to discuss, we all agree, I think, that climate change is the single biggest threat that compounds existing burdens of disease and widening health inequalities. The climate change leads to extreme weather events, heat stress, disruptions to food systems, and degraded air quality. That can lead to illness, vector-borne diseases, malnutrition, and mental health issues are just some of the issues that are being explored that are not fully understood perhaps by those that study climate change, although there is a growing understanding of the intersections of these issues with climate change and more research is being done. And this is something at Globesight we feel very passionately about. This affects livelihoods. It impacts social equality, gender equality, access to healthcare. And of course, for those that aren't able to insure themselves, it costs a huge amount of money and leads to increased poverty and disruptions to social support. Next slide. We also have the impacts of increasing malnutrition and food insecurity in Pakistan. Increasing climate events and extreme climate events reduce crop yields. They destroy livestock, they disrupt water and food management systems. And we've seen from the August 2022 floods alone a 53% increase in malnutrition cases, 14.6 million Pakistanis requiring emergency food assistance. Not only that, increased CO2 levels make crops less nutritious. Pakistan malnutrition indicators show that 40% of children under 5 suffer from stunting or wasting, and anemia is currently at 41.7%. Additionally, we have heat stress and increased pests and diseases, which affect agricultural production and, of course, affecting the balance of payments, leading to more imports. At a time when food prices are only going up, this is causing stress not only in local communities, but in central government as well. Next slide. So we need to accurately assess the risks and scale these climate-induced threats and build resilience through adaptation efforts. The first step, of course, is assessment. Data managing, mapping, and of course, scientific research all need to come together to better identify the nature of the problem, how it manifests in the Pakistan ecosystem, and what we could do to overcome that. From the policy-making side of things, of course, increased health and nutrition allocating in national spending would be advisable. If we can do that through aligned private and public initiatives for investing in resilient health, that would be even better. And then not only that, understanding at the policy level how we can respond to these types of shocks better in the future to build resilient social protection systems and agriculture. Last but not least, of course, is the issue of adaptation, smart water and food management, climate-informed health early warning systems, and climate-resilient sustainable health facilities. Last but not least, capacity building at the local level, including education as being a critical form of capacity building and increased resilience over the next few generations. So that's enough from me. We have our expert panel who we will be coming to now. And I look forward to a very robust discussion. Please do send your comments and questions to all of the panelists, and we will look forward to an interactive session. So if I can first come to Afia just for some opening comments, please.
So thank you very much. I mean, it's an honor to be a part of this panel and a bit daunting because I'm in company of experts, subject matter experts, which I can never claim to be. So first of all, I think it's, I'm encouraged by the fact that more and more organizations and people are now taking the Nexus approach. Because earlier it was just put into silo that this is climate change, and it was seen more in the context of a meteorological or scientific phenomenon that people need to understand and cope with. But its fallout is impacting each and every sector of life. And now more and more understanding and realization is dawning on people. And I think this is the way to go. Because if in Pakistan's context, we do not yet have an adaptation policy. So the SDGs, which I'm sure Rumina will, speak more on because that's her area of expertise, are like a pathway. And all SDGs being connected to the next one, you can't just pull one out and say that we've met this and we've achieved our goal. Underscores the need to look at things in with a Nexus approach. So that is one thing. And this is why multi-sectoral, multi-stakeholder input is needed in the conversation of climate change. And I'm glad that, the health and food security or insecurity as Pakistan is facing or at least half of Pakistan faces, according to the statistics that are there in, our National Nutrition Survey that was carried out in 2019. So I think this is a very good springboard of this conversation. So thank you for that. And it's just one slight correction, rather couple, that I would like to make. I wasn't trained as a geologist, rather as a geographer. And the other thing is that Pakistan did not initiate the loss and damage conversation. The events that happened in Pakistan last year were showcased in a manner which brought, that push to the shove, because the conversation has been happening even pre-COP. And somehow it never really went beyond the conversation. It was always on the periphery of the final announcement. But I think we were able to push that point along with all other vulnerable countries, especially in Global South, that there has to be an agreement to mainstream and make a mechanism. So we look forward to those. These things are very slow moving, but to get to that agreement itself was a big achievement. So I'll stop here.
Thank you so much, Afia. And if I can bring in Dr. Ismahane, please.
Thank you very much, Michael, and thank you. I agree with what Afia has said and also your introduction. So definitely, in terms of Pakistan, particularly, it's one of the examples where really climate change impacts has really started a huge, series of events. So definitely, when we look at the global picture, climate change is emerging as one of the most pressing challenges of our time, with really far-reaching implications of various aspects of human life, including health and nutrition. And I think scientists have been talking about it for a very long time. But what we are seeing right now is that policymakers believe in it, population and the civil society believe in it. And hence, we are coming at a mature time where we are all agreeing that climate change is the big elephant in the room, and we need to talk about it and address it. Particularly for Pakistan, the country already is grappling with multiple socioeconomic challenges, and the convergence of climate change, health, and nutrition poses unique and significant threats that require urgent attention and proactive measures. So you mentioned the impact of climate change in Pakistan, but maybe let me just reiterate that Pakistan ranks among the top 10 countries that are most affected by climate change, and that's based on the Global Climate Risk Index of 2021. The average temperature have increased by about 0.6 degrees over the last century. The frequency and the intensity of extreme weather events, including flood and drought, have risen significantly. And we have also the impact of the glacial melting in the Himalayas, in the Karakoram ranges, that are affecting freshwater availability. And that combination of so many areas shows very well in the numbers. So when we talk about health and nutrition in Pakistan, we have about 40% of children under the age of 5 in Pakistan that suffer from stunted growth, leading to impaired physical and cognitive issues. We have the climate change-related health risks, such as heat-related illnesses and vector-borne diseases that are increasing. We have waterborne diseases, including, again, diarrhea and cholera, that are prevalent due to inadequate access to clean water. So the climate change impacts are multidimensional and can manifest in several ways. Pakistan, being an agrarian society, heavily relies on its agriculture sector for both food security, but also livelihood of those communities, agrarian communities. However, the rising temperature, the irregular rainfall patterns, and extreme weather events such as floods and droughts have very much affected the agricultural productivity. So all of these climate-related disruption in the food system can have profound consequences for the availability, the accessibility, and also the quality of food, and hence will directly influence the nutritional status of the population. And one of the primary concerns arising from climate change in Pakistan is really the increased incidence of food insecurity and malnutrition. So as I said earlier, the changes in precipitation patterns and the prolonged drought have led to reduced crop yields, livestock losses, and decreased availability of fresh water. And as a result, vulnerable population, particularly those in the rural areas and marginalized communities, face challenges in accessing an adequate and diverse diet, leading to deficiencies in very essential nutrient. And what we are doing as FAO, it's really, we have what we call our strategic framework that aims for a transformation of the agri-food system with all partners towards what we call the four better: better production, better nutrition, better environment, and better life, leaving no one behind. And the way we're going to get to the four better, it's really by transforming the agri-food system and make them more inclusive, more resilient, more sustainable, and more importantly, more efficient. And within that, what we are doing in Pakistan with the government of Pakistan, it's a series of programs that are under our strategic framework and our two main strategies: climate change strategy, as well as science and innovation strategy. And all of them are under climate resilient agricultural systems. How could we really promote sustainable agricultural practices, including water conservation, including crop diversification, nutrition sensitive diet, and the use of resilient seed varieties that hopefully can really increase productivity, but also nutrition in Pakistan, that can really show impact on both the economy, because the livelihood of this large population in the ag sector, it's large, but also on the nutrition, and reduce a little bit the numbers that I mentioned earlier. Over to you, Mike.
Thank you so much, Dr. Ismahane, and there's plenty to interrogate there further down the track. And last but not least, Dr. Farhana, would be fantastic to get just some opening comments from you.
Thank you so much. I'll be brief in my introductory remarks. I think so I can give my career started with working in the clinics as a health professional. And while treating the women and children in the clinics, I realize it is the time when women are coming already are diseased or malnourished or anemic. So let's start with working in the human nutrition, which is not only the food that we intake, but also the environmental health and the care that women and children get to actually prevent themselves from getting diseased or malnourishment. So while working with the malnutrition and addressing the issue of malnutrition, we come across with the adverse effect of climate change. And now we realize that it's not health only, it's not just the nutrition, but also the climate change is actually the issue which needs to be addressed in the beginning. So to make our people not only the vulnerable, but also overall as a population of the country to be healthy and contribute towards the development of the country. So I think so as a nation, we are always address the issue or the disease when it's already happened, or we always address the issue when it has happened already, and we kind of not from the beginning or from the proactive approach we don't take. So this is I think so right time for us as a nation to actually think about or invest in the climate change interventions for the health and nutrition issues of the women and children in Pakistan. Over to you, Mike.
Thank you so much, Dr. Farhana. I'm just going to follow up with a question, which is that as a diagnostician, clearly you were seeing an increase in these types of health problems, and then understanding that some of the impacts of climate change were leading to an increase in some of these problems that you were seeing. At what point do you think the health sector in Pakistan began to understand that this was a far greater problem than simply a healthcare or clinician issue? And what are the types of conversations that healthcare providers are having with climate change professionals to help overcome some of these challenges?
So frankly speaking, while working in the hospitals and the clinics, when you see mothers with less than 7-gram hemoglobin, pregnancy with the twins, and also a large number of the under 5 population coming with diarrhea, with the adverse effect of the environment, and which resulted in infectious diseases, and it's not just the seasonal, but also as a routine, the number of infectious diseases, malnutrition, underlying factors. This all affects the health systems, and the investment and the financing at the public sector hospitals is really low. And we all know that the most of the population, they access private sector for their for accessing health services. And out of the pocket expenditure for receiving those services in the private sectors further aggravate the problem. And these poor population, especially women and children, they get those health problems, and then and the problem get worse. Not only they increase the debt at the household level increases, the food insecurity also added to their problem. So it's the not only the health sector, but it's also the other socioeconomic determinants that actually increases the problem of the households, women and children in the country. And we all know that the rural population and also the poor population are also most commonly affected, not only because of the poverty, but also the effect of the climate change, especially the floods.
Thank you so much for that, Dr. Farhana. I think I'll go to Afia just as a sort of follow-on from this. And clearly there's a policy question here for the Pakistani government to handle. I think it's fair to say that Pakistan is facing a number of problems at the moment. Some people call it a polycrisis. I think I'd just call it a crisis, frankly, in general. Where do you place the climate and perhaps the health debate in amongst all of these issues Pakistan is facing? Does the government have enough time, enough resources to try and tackle these issues? What are the ways it could be tackling it better? And what are some solutions perhaps for those outside Pakistan to be able to help or in some ways assist, perhaps driving those conversations or even resource discussions?
Okay, so obviously there is no silver bullet. And you sort of, you've laid out all the problems that they need the answers. And had we all those answers, probably, we would have been able to take care of all these problems. I think the first point of starting on this path is, which you mentioned in your slide, is getting the data. We need to map out the issues. We need to map out the vulnerabilities. We need to map out the location of those vulnerabilities. And, if I put my geographer's hat on, we need to try to connect how the location of where those people are located, the vulnerable populations. Is the location a reason for exacerbation of their problems? Be it, keeping them in the pathway of disasters, which we have seen not once, but twice in 2010. The majority of the damages that people suffered were because they were in the pathway of the floodwaters. They were in the riverbed. And this time too, the same thing has happened. Now, because of the low social economic indicators, when a disaster strikes, then everything unravels for the government as well as for those people who are hit. And there obviously are not enough resources, and the prioritization of these problems which we have before us, then that suddenly shifts. Like if I give the example of last year's floods, there were several projects in the context of climate change, which were long-term, which had been planned out with, pretty well mapped out. But entire funds at the disposal of the government were repurposed for flood relief, for reconstruction, for rather rescue. In fact, that was the first priority, because 1/3 of Pakistan was underwater. So it's like you don't get any kind of a breathing space. Yes, there are plans. Yes, there are, there efforts at capacity building of people who are to put those plans into action, to implement them. But then something like this happens, and as Dr. Ismahane mentioned, Pakistan has been, it's not just last year, Pakistan has been in the top 10 bracket of the global risk index for over a decade and a half. So there's been very little breathing space. Now, having said that, I do acknowledge that the realization is growing and the sense of urgency is there. For the first time in Pakistan, the national security dialogue and the national came up with a national security policy, which included climate change as a factor which impacts national security. Now, generally, earlier, the word security was looked at in a militaristic term, those kind of security issues. But it was acknowledged that the problems which are a spin-off of the climate change impacts in Pakistan, which include health, which include climate-induced migration, which is a huge social displacement and cause of social strife, which includes, lack of accessibility of health, of education facilities, are all factors which can impact national security. So that realization in itself sort of reorients the actions that are going to be taken. It's just that, like I said, the disaster was of such a magnitude last year that very little could be done by way of starting on that path of putting that implementation and getting that Nexus approach, which I appreciate that you are taking here, addressing two basic fundamental sectors of food security and health. But similarly, there are other intersectional issues which you keep sort of plugging in on a broader level. Like there's this issue of gender disparity. When we look at climate change with a gender lens on, we see clear disproportionate impacts on women and children and other vulnerable segments. So some kind of an affirmative action needs to be taken to address those. But for that, again, there needs to be a mapping of the vulnerabilities, the mapping of the resources and the allocation of resources, proper planning. And this is where, that it's not just the clubbing together of issues, but clubbing together of the actors who can have an input and have a positive impact through their, bringing to the table the research they have, the technological and technical facilities they have, that technical, the transfer of technology, transfer of knowledge sharing, all these things need to be coming together. And I think slowly and gradually, even at the academic level, the debate on climate change now looks at it as an intersectional issue. And, as a journalist, I may not be writing as much. I speak more now at forums like this. I do feel encouraged by the broadening of the debate, because it is that broadening of the debate that will get us ultimately to that solution. Right here, we are talking about food and health, but then economics get into it, then politics gets into it, then so many other things, we have to grab them and put them there on that same table to be able to come to a solution. So this is how I see it panning out. Unless and until this happens, we cannot really look for those solutions which are in silos. If we only focus on health and not on nutrition and not on...
Oh, I think you're on mute there, Afia.
I don't know how that happens, sorry. So I'm saying if we only look at one thing, like if you're looking at nutrition and not at agricultural practices, which are being impacted by the climate change, like we are having this phenomenon, which we have not yet named properly, but we call it the pre-monsoon, which the farmers need to understand that they need to change their cropping pattern, because we are having monsoon-like rains in March, April, when there's standing crop which is being flattened, where we are suffering from livestock losses because of these severe hailstorms. So, those sort of multiply on an economic level, the poverty level of the farmers, because most of the farmers in Pakistan are small farmers. There are very few, very large land holdings. Percentage-wise, we don't really have very many large farmers. So for them to come out, to bounce back from that damage, it's very difficult. So unless that research is there, which can give them that warning. You have already mentioned the setting up of early warning. It is not just for disaster prediction and early warning. It is for our agricultural sector. And then also the training of farmers and, the new kind of seeds that can provide them yield. The way our farms are being irrigated by the ancient method of flood irrigation. So we are losing our water resources. So again, it's all a mix. And unless we take it as one composite whole, the solutions will be difficult to come by. I'll stop here.
100%. And, I recall in the first years of my career talking to the British military about climate change. It's a long slog, and getting the guys with medals, as we used to call them, to care about these issues was, I think, one of the greatest successes that we had in our policy debate. And I'm very encouraged to hear that something similar is happening in Pakistan, which of course will hopefully lead to some institutional change and drive to deal with these issues, even if through a security lens, which can be a little narrow. I want to move on to Dr. Ismahane, who has been waiting very patiently. Thank you. And I want to bring in some of your sort of global expertise and, of course, work in other climate-stressed environments and countries. And wondering if you see some linkages in the Pakistan context with climates that you've worked in before, geographical areas that you've worked in before. I wonder if there's some best practices you could share, some challenges that you've come up against that you see linkages with, that people on the call might be able to learn from and adapt.
By the way, Michael, your voice once in a while disappears and comes back, so it's not very steady. So if I got it right, you are asking about best practices from other parts of the world, right? Yeah. So I think really it's along the lines of what Farhana and Afia are already touched up on. In terms of the agri-food system, there's definitely a need to move towards more climate resilient agriculture systems. And I think here, adaptation to climate change, it's an area that maybe we have not invested enough. As the debate on climate change started over the last 20 years, there was more focus on mitigation, and most of the developed world were willing to put in some recompensation for mitigation, not so much, mostly for offsetting their greenhouse gas contributions, but not enough on adaptation. So what we have seen in Pakistan and in Nigeria and in many other countries really bring back the need for an adaptation agenda. And the adaptation agenda implies really a transformation of the agri-food system and also the really adoption of technology. So if we take the adoption of technology in Pakistan, it's very low. And the adoption of technology is very low because the innovations are very expensive. So if we want to really encourage the smallholder farmers to use more improved seeds or to use better irrigation systems or to use better to reduce their food waste and loss, particularly loss in the field, loss in the field. So there is a lot of things that could be done, and those have been really proven, have been used mostly in the developed world again, not enough in the developing, and we need to really tackle that problem of inaccessibility of knowledge for the farmers and inaccessibility of innovation because of the cost. So this is one area that is a must. So by moving to climate resilient agriculture, one area that we need to do is scaling up at a very large scale, really that adoption of technologies that will allow the farmers to produce more with less. And in that producing more with less, we are talking about quantity and quality. So definitely we need to increase our production in Pakistan, but also we need to increase the quality of the food in Pakistan, particularly looking into micronutrients that were mentioned by Farhana. The micronutrients, particularly for the kids and women communities, it's very important. So some of the best practices that we have been really working on with Pakistan and others, it's using more advanced technologies in terms of genomics to diversify the diets, and also to have better seeds in to the farmers. The other technologies also, it's using advanced technologies in terms of soil health, for example, or use of different qualities of water. There is a lot to be done as well in terms of post-harvest, be it to reduce again the loss and waste, but also to make sure that we are keeping the nutrition very, very high. So be it an enzyme, be it on the amino acid, be it on the vitamins, all of these components are very important. So I think definitely, in addition to mapping that was mentioned by Afia, mapping the agriculture sector in Pakistan and mapping the issues, I think it's done. Now it's about really addressing it. I think really, at least maybe there isn't enough mapping in terms of investment and in terms of maybe support from the government, but in terms of issue, we know it to some extent. So now it's about really enrolling large programs, including safety net programs for the farmers, insurance for the farmers. So we tend to do the compensation after that. We tend to go and help the farmers after the flood or after the fire. But sincerely, this cannot continue with the intensity we have, with the frequency we have, the high frequency. We have to build in insurance and safety net for the farmers from the beginning. So we need to do that. And I think the mapping we have about Pakistan right now allow us to do that. And we have to make sure that we use the momentum now after the crisis of Pakistan to really bring in the international development, but particularly the public sector and the private sector in Pakistan to help in that recovery plan. And that recovery plan has to really benefit the farmers this time. We should not allow it to be diverted and to go to different actors, but rather needs to be focused on the small holders. As FAO, we have multiple programs in Pakistan, and we stand ready to do more. And all of them are really around using the data that you were mentioning, Afia, using the data to have a proper plan in terms of investment, proper plan in terms of enlarging the adoption of technology and rolling out a new innovation to increase, as I said, production and productivity, both in terms of quantity and quality. The other things that need to really to be more used in Pakistan, it's early warning systems. We do have some good systems in place, but I think really the issue with climate change, and this year it's going to be the Nino year, and that will increase really the Nino after July. Based on what will happen in July, we will have a better understanding of the likelihood of the Nino happening. Right now, we're talking about maybe if it continues the way it is, it's about 80%, which is very high probability. And hence, with the Nino, there will be a huge climate condition that will affect Pakistan and the farming community in Pakistan. So we cannot wait for more precise early warning system. We need to really use what we know. We recognize, all of us, that we don't have it 100% sure. It's all likelihoods. But based on those high likelihoods or medium likelihood, we should have programs in place to make sure that we don't get the same drop in terms of malnutrition in Pakistan as it happens with the flood last year.
Thank you very much, Dr. Ismahane. Can you guys hear me now? I've gone to earphones. Is this better? Okay. Maybe I should have done this half an hour ago. Anyway, thank you for bearing with me, everybody, on the call. So we're going to open it out to the floor now. And the first question is for you, Dr. Farhana. What are some of the innovative solutions for the health sector in Pakistan that you think Pakistan could take to the global level, particularly with regards to the COP discussions coming up in November, December this year?
Thank you so much. I think so much have already said by my learned speakers. But I would like to add over here is beside the mobilizing the public sector, we have to leverage on the private sector investment as well. and for the vulnerable population in Pakistan to prevent them the effects of the adverse effect of the climate change. So we need to explore the sustainable business model for private sector to expand and innovate, because the private sector has reached to the unreached population, which sometimes public sector could not reach. So I think so we need to utilize this private sector for this vulnerable population, and also to reach out those vulnerable population. And also we need to boost the sustainable agriculture and economic development. And as earlier said by the speakers, that we have to bring in the new innovations for the farmers to increase their income, and also to increase their access, especially the smaller farmers, to the market. We need systematic innovation solutions for the climate adaptation and climate mitigations, not only for the agriculture sector, but we have to see in a holistic way the agriculture sector, the food system, and the nutrition system to address the issue of human nutrition in Pakistan. Over to you, Mike.
Thanks so much, Dr. Farhana. I'm going to go with a slightly wider question. Just from one of our audience today, which is, I think probably for Afia. Could you share some light on the role of the media in educating people about climate change and climate change adaptation? How do you think the media is doing in the Pakistan sphere, and what is the general public perception of climate change issues?
So I would hate to knock on the fraternity that I've always belonged to, but media has not really been doing as well as it can and should, because of the one of the business model. One reason is the business model of the media in Pakistan. The other, of course, is the very slow catching up by the media of the realization, which unfortunately looks at climate change as a met or a disaster event. So it's actually coverage of disaster which sort of brings to the fore the conversation on climate change, not climate change per se, and its intersectionality and impacts on each and every sector of our life. So this is one problem. But having said that, there are very good journalists in Pakistan who have been writing on issues with a holistic lens, who have been addressing the elephant in the room, which is our population, which we cannot, not look at as the cause of many of the issues, why we cannot seem to find the resources, or why we cannot prioritize things like tech innovation or coming together of different sectors on the same table. So media has been slowly and gradually, through its coverage of disasters, bringing in the aspects. It allows us the opportunity of, allows people who have been focusing on climate change and its impacts to sort of get a foot in the door and speak of larger issues and interconnected issues. The other problem is that within the media, there are no segments which address a certain section. There's no segment which is dedicated to climate change, environment, and health issues. They are mostly event related. So this is my gripe, as far as my own fraternity is concerned, and I've been voicing it quite frequently. As far as the understanding within the public is concerned, because of the frequency of the disasters that we have been faced with, people seem to know that something is happening. They may not necessarily be able to articulate the term climate change. But if you speak to the farmers, especially the older generation, they will be able to tell you that, the weather is changing. We used to plant it at this time and now we can't. Or we used to plant this crop and now it's not being planted. So that broader understanding, or because of the rising realization that heat is also a climate-related problem that Pakistan is now facing. I think before 2015, when the heat wave was so disastrously experienced by Karachi, there was not realization of the impacts of heat on human health, especially the ambient temperatures. Then the air quality issues are now coming to the fore because of loss of working days and the impact on the health. which you experience during the winter months in the plains of Punjab and parts of Lower Sindh. So the realization is growing. I wish, it could be fast-tracked. I wish the media would open up and look at these issues as social issues rather than, prioritizing only political issues. But like I said, there's a business model issue. Also, the audience has changed. Most of the audience now uses the cell phones, the younger audience. And don't forget, Pakistan has over 60% of its population, which is, what we call the youth punch. They do not access the media that we were used to. They are not looking at those long, in-depth articles. So they want these quick, snappy kind of question and answers or speaking about the issues. So where the media is lagging behind is it is not tapping into that audience, not creating the content which can make them understand the issues in a way that they are used to consuming. It's not just for entertainment, it is also for information, but there is an element of infotainment which can be brought in if that is what people are looking for, to disseminate the kind of information that they must have. They must know what, glacial lake outburst flood is. And if the younger people want to do it through TikTok or Insta, so be it. So not enough of that content is being generated yet. I sort of now, despite being a dinosaur, I rest my hope in the digital media now more than the mainstream media. I think there's a lot of possibility because they have a greater outreach. They have understood the appetite of the people to have the kind of content which caters to the people who have a short attention span. We must realize that the attention span is getting shorter and shorter, which makes it a compulsion for the media to retain those eyeballs with good content. So I think the training of the media to create content to address these issues through the new platforms available, we need to invest in that also as far as climate change communication is concerned. I'll stop.
I mean, that's a really interesting point. And I think back to my own understanding of the floods in Pakistan, and actually most of the content I accessed was through Instagram. It wasn't through reading the paper, and it was literally some people uploading from the village that they were in, and you could really see the impacts of the floods in a way that I don't think was being translated from the press. Hi, Ismahane.
Michael, maybe if I can just add to what was said, is that really there is a huge responsibility in terms from the public and scientists in terms of communication. So the digital world has created a lot of misleading knowledge or misleading information. And I think really there is a huge responsibility to media to make sure that they have accurate and strong argument for anything they say. So I think media are becoming less and less, more they do the due diligence in terms of veracity and accuracy of data. And that really has to be brought back to media, and they have to make sure they do use the best knowledge and they have the references as well, strong references. The second group that needs really to get into mass media, both the public institutions, but also the scientists. And within that, for us at FAO, as part of our science and innovation strategy, we are really taking very seriously science communication to clear up some and demystify some of the information out there. So many technologies are great and could make a huge difference, but are stopped because of misleading information. And hence what we are doing, it's really a large scale partnership with many partners to see how we can really communicate better and provide farmers with better knowledge. And here I want to touch up on really the power of digitalization. As it was said, in terms of digital media, it's very important, but using digitalization at large to really spread the knowledge and to get information to farmers to change their practices towards more sustainable or less risky, particularly in terms of adaptation to climate change, it's very important. So we do have means to do it better. And we need to be responsible, all actors, be it the media, the public, the scientists. So we need to take that on and clear up, demystify, and take off all those misinformation out there and increase access to knowledge for the farmers through the use of big data and digital tools. Over to you, Michael.
Thank you so much for that, Dr. Ismahane. I'll bring it back very quickly to Afia because you've got your hand up, and then I'll move it back to a health-related question.
Yes, thank you, Michael. And this is exactly what I wanted to take it forward from what Ismahane said, that the presence of correct data is so important, but access of the media to that data is usually not there because the science and the media, the science community and the media don't really interact with each other. The language that they use needs to be tailored for the understanding of the common people. And that can only happen with a constant, like she said, science journalism. But that science journalism has to be understandable. We must, I can't emphasize it enough. Pakistan has one of the highest tele densities. We have one of the easiest tools to be able to reach even the smallest of farmers, because everybody and their aunt has a cell phone in their hand, and even the use of smartphone is increasing exponentially. So we must capture and we must have that interaction between the academia, between the scientists, between think tanks, and learn how to translate the knowledge that they have. Because if I am writing, or if I'm saying, or even I'm putting an Instagram post, if I just say that FAO says this, or UNDP says this, that will carry a lot more weight than just giving my opinion about or my feelings about something. So that, we need a bridge. We need that kind of a bridge for the media to be able to carry that information back in a language that people will understand. Thank you.
Thank you very much, Afia. Fascinating conversation, and certainly more to do on this front in terms of thinking and joined up work. Coming back to you, Dr. Farhana, a couple of questions really. Firstly, could you discuss, and this is from Naveed Bhutto, what the indirect mechanisms are by which climate change impacts particularly maternal and neonatal health? And building on from that, do you see a correlation between the rate of malnutrition in areas of Pakistan that are most vulnerable to climate change? Is there a direct pattern which you can map onto these geographic areas?
Yeah, thank you so much. I will take the first question, but before the question, I think so I will add to the earlier discussion that was really, really fascinating. And bringing in the science, I would say, please include the business community, political leaderships into this group. The discussion should go beyond just not this media and the scientists, but also to the political leadership as well, to make them understand where to put in the resources and where they need the gap, where is the investment gap, so that they can bring in the other stakeholders. So coming back to the question, I think so indirect mechanism could be, as we earlier discussed as well, that beside the health system, there are the nutrition and the climate change. I would say it's a cross-cutting. It's a multi-sectoral issue. So the social welfare, education, everything is affected by the climate change, and the most vulnerable population is our women and our children. We all witness that because of the climate change, our hospitals, the basic health unit in the rural areas, they all destroyed. The schools were most commonly affected, and these are the schools which are from the government, the public sector schools. Who goes to the public sector schools? The most rural population, the most poor population. So they are not, already the Pakistan is facing the problem of out of school children. And now because of the effect of the climate change, because of the destruction of those schools and the basic health unit, they are temporarily living in the shelters, and they were like compromised accessing the education as well as the primary health care services, not only at the health facility, but also at the community level. So these are like, and we all witness, those who are working in the emergencies, that the women who were pregnant, who were in the shelter, in those camps, how poor was the quality of services that they were bound to receive. And already Pakistan is facing the adverse effect of malnutrition, which indirectly affects, and also not only the maternal but also the poor nutrition indicators of children less than 5 years of age. We all know the numbers. We all know the problems. Now it comes the question of addressing and addressing the challenges of providing services to this vulnerable population. I think so. In the public sector, we need more adaptive and flexible delivery of services to these vulnerable populations. So, and also the quality, the training of and the capacity building of the healthcare provider, not only the public sector, but also bringing in I would again emphasize the need to bring in the private sector, because this is the private sector and the non-governmental organization, those who work with the most vulnerable population down the line, where the public sector cannot reach, to actually build the capacity of those who are at the grassroots level, or I would say the front level, to actually provide a quality of maternal and newborn child health services. We all know the poverty already pushes the vulnerable population into the intergenerational poverty and intergenerational malnutrition, which is not if we start working on malnutrition now, it will take like 3 generations to actually bring in to see our girls and our children healthy. So there is like it's a strong commitment needed, not only from the political but also from all sectors of the society. We have to think about solving the saving life issue and the climate change issue, adverse effect of climate change. We have to see it as like across the politics and above the politics to save those precious lives. I would end here.
Thank you very much, Dr. Farhana. And I'm aware that we're approaching close to time, and Dr. Ismahane has to leave imminently. But I've got one more question, which relates to both the role of microfinancing in the country and also the role of institutional and multilateral financing in order to fill some of these gaps. So I think if I can go first to you, Afia, about where you think the role of private, well, we've talked about private sector anyway, but microfinancing as a tool, and then specifically, perhaps we can have a discussion about the COP mechanisms. I know you've talked quite frequently about the role of COP27 and the loss and damage fund, but are there any other creative mechanisms that could work in Pakistan context?
So I'm very happy that Farhana has mentioned this thrice, the role of the private sector, because one of the unaddressed decisions of the Paris Agreement was the introduction of NMM, which was new market mechanisms, which called for bringing in the private sector into the climate change mitigation, obviously because their processes are so damaging. So we needed the greener processes and mitigation of emissions from the industries, but also because there is a lot of unlocked finance available with the private sector, which if once they are made to realize that they have a role to play, they have a place at the table of climate change solutions, then it can be unlocked much faster than the multilateral institutional assistance that you have just mentioned at a smaller country level or at international level, because we have seen that the private sector is a lot less bureaucratic. Once a decision is taken, the money is released immediately. The money is tracked, because it's a profit-making enterprise, so they track every penny that is spent. So they need to see it being spent in the right places. There is a lot of, expense that doesn't really benefit the people that comes from the public sector. We all know that. So this way, you are sort of beefing up putting it more in the kitty, because loss and damage, as I mentioned, has only just been agreed to that this will also be a mechanism. But the adaptation fund, the Green Climate Fund, those commitments have not been honored completely. We were supposed to have 100 billion, it never went beyond 60. And the disbursement and the very complex mechanisms to be able to access them makes it very difficult for small scale financing. So it has to be maybe at an institutional level, at the government level, there has to be a one window which can allow for financing of small healthcare solution providers from the private sector on what we in Pakistan call the PPP mode, which is the public-private partnership, which has actually worked. So I'm sure that is why Farhana has been mentioning it, because wherever it has been put in the right spirit and with the right mechanisms, it has delivered. So I think we need to look at those things very much. As far as Ismahane had also mentioned, the crop finance, or rather the agricultural finance, as well as this safety net. Both these things have to be combined. I think the banks now, the insurance companies, they need to work in tandem to get that understanding that climate disasters are something that are connected to them as well, that will impact their business as well. So once they realize that it's going to hit their pocket, probably they will come up with those products. They call them products. Yes, they are products, financial products, which they can offer to the farmers, to the small scale farmers, as well as the downstream industries from agriculture, agro-based industries. So I think we have to look at that. And yes, that requires a lot of tech innovation. And if I'm allowed to give, because you ask for creative solutions. And it's not just the financial solutions. It's the baseline of that financial solutions come from information. And there is this progressive farmer in Punjab who, because of his understanding of climate change and what they need to be climate smart farming, has set up a small digital hub at his farm. He set up a few computers, connected them to the internet, and he invites farmers from all around his area to come and sit there and access websites which will give them the information, which will give them how, the new cropping patterns, how to become climate resilient. So these small innovations are there. I can just quote one because this is what I know of. I know there are farmers elsewhere who are accessing information, who go for trainings. Our universities are the national institution, which is National Agricultural Research institution, and it is at the provincial level also. They are also coming up with very innovative solutions. It's just the scalability which requires the resources. And I can see a question from Hamid here in the chat, that how does that happen in a resource-strapped country like Pakistan, which is being hit by disasters repeatedly? So that is the problem, that, we need to be financially stable to be able to put in place or scale up these kind of solutions. And I think tech innovation is one, but the other is, of course, getting the private sector involved, because everything hits every sector. So when they see that it's going to come back to them, if there's no food nutrition and if their workforce is not able to produce or rather deliver on what their production targets are, simply because most of the people are either malnourished or coming from those kind of backgrounds where they can't be good, productive human beings. So maybe that realization will seep in and they will step in. I'm hopeful on that count, but yes, the conversation needs to bring them in.
And if I could just bring you in very quickly, Farhana, for her reaction on this, whether it's from a financing point of view or a technological point of view at the local level, and then we'll wrap it up.
Yeah, I think so. Unfortunately, it's just not the Pakistan, but it's a global phenomena. The investment that we need now is the need is high, but the global investment in nutrition and the health related is decreasing. And we all know that there is a 10.8 billion annual funding gap, and only 1% of ODA which is official development assistance, is allocated towards the basic nutrition. So we need political commitment or political leadership, and the capacity of the political leadership to actually negotiate for this important issue, which is very much linked to the health and nutrition. And as very rightly pointed out, if the human capacity to actually economically produce is not there, then how can a country can develop or can bring their resources in place to actually produce more GDP and GNP in place. So I would like finish over here is that at all levels, all stakeholders has to think about investing in the nutrition as well as in the health to uplift the human capital index, which is very low at the moment. In the Pakistan is not competing with the other neighboring countries, and investment is very crucial for the public sector as well as the other sectors, the private sector, to bring in the change in the life of their own people. Over to you, Mike.
Thank you. Afia, just very quickly, a 30-second intervention.
Yes, and that, that intervention is that when the assistance is sought, it is usually given in the form of loans, which actually is counterproductive. So in extreme situations, countries like Pakistan need assistance, not loans, not more loans.
That is a fantastic point to end on. Pakistan needs assistance and not loans, and I think we can all agree with that. Those of us who are constantly tracking the discussions about IMF and all the rest of it, perhaps it hinders rather than helps some of the issues we're talking about. I think just to sum up, really, there was a lot of focus on innovation, innovation in science and communication, innovation in terms of technology, but also at the same time as we were relying on that innovation process, we're talking about utilizing the human capital of Pakistan a little bit better. Some of these farmers already know how to adapt their crops to climate change. They're not silly, they've been doing it for decades and they understand these things. It's helping the technology adapt those practices that they already themselves kind of know and I think have an instinctual understanding of. We mentioned some very unusual actors. The military has come into play. We've got think tanks. We've got the media all coming into this sphere of climate and health that perhaps I didn't expect that we'd be talking about today, but we've certainly thought creatively about the way in which to make more use actually of the securitization debate, the digitization debate, and actually in all ways trying to join this up into some kind of holistic approach to climate change and also health and understanding of health. Clearly, last but not least, it's funding gap that Farhana identified and that we've been hovering around for the last hour or so. Innovative finance might be the solution to that at the global level, and that's something we can explore a little bit more in our roundtables at Globesight in the next couple of months as we go ahead to COP28, but also the role of microfinance. And I think something more needs to be understood about how microfinance and climate adaptation and mitigation can tie together to help the people of Pakistan overcome their challenges. So I'll just tie it up by saying this, obviously Pakistan has had some serious climate disasters over the last 15 years. And I think we all hope that there isn't one this year, although we know, I think at the systemic level, there is going to be challenges either with crop production, malnutrition, general healthcare, and this is all going to require increasing, I think, attention at the global level and also from the government of Pakistan. So thank you to all of you who participated, Dr. Farhana, Afia, and Dr. Elouafi, who has left us, I'm afraid, and I think thank you to her for driving and also contributing. That's not an easy thing to do. And thank you very much to the website for hosting this conversation, and we hope to see you for the next series of our roundtables. So for now, thank you very much and goodbye.
Thank you for having us.
Thank you.
Great conversation.